It was only those patients that had a significant amount of disease in the bone marrow that developed these fevers. And these fevers are likely to be caused by cytokines, which are hormones that are secreted by immune cells, in this case the T cells. And that is perhaps not at all that surprising. The T cells are infused into the patient. They go into the marrow, they recognize tumor cells, and they become activated. And as they become activated, they start to secrete these cytokines. And much like when you have a fever from the flu or from any type of infection, it's the same process that your temperatures go up, your blood pressure can go down, your heart rate can go up. All of these things are similar to what would be a flu-like syndrome mediated by these cytokines that are secreted by these activated T cells. Now, the more T cells that come into contact with more tumor, the more of these cytokines are going to go up. So those patients that only have a little bit of disease left, there's not that much of an interaction between the T cells and the tumor cells, because the T cells can kill off the tumor cells, and you don't have such high cytokine levels. So one of the significant things we found was that there was a correlation. The more disease you have when you get the T cells, the more likely it is that you're going to have these fevers, low blood pressure, high heart rates. And conversely, when you have very little disease on board, you're going to have very little adverse reaction. And so what we learned from this is that moving forward, we should treat patients in the context of when they would have the minimal amount of disease. So therefore, we are more inclined now to give the T cells at a time soon after they get the salvage chemotherapy, before the disease, if it's going to come back, comes back with a lot of tumor in the marrow.